So here are the couple exercises that seem to work really nicely. I have the cows do. First one's, I had a little kid, was the itsy bitsy spider. You put your arm against the wall, elbow against the wall, right shoulder blade against the wall, and make your fingers go up the wall. And as your fingers go up the wall, you keep your back against the wall and you get to this point. And you do the same thing on the left side. Coil your fingers up the wall, and as you get closer, that's like this. Now, one of the things I know you guys can do is if I tell you to pick up your arms post-surgically, you can probably go just about here, maybe here, because there's too much tension. It hurts too much over here. But I do know if I ask you to raise your arms, you can get higher this way. Well, in that plane, you're not really stretching your pec muscles. In fact, if you do this, your pec is pretty soft, versus you go over here, your pec is tighter. That's why it's harder to go up like that. You will be there within 2 weeks after your surgery, but the other exercise for you to do is, I can't do it because I don't have a whole lot of hair, but make believe you have your brush or a comb, and you're combing your hair. So, comb your hair like this with the right hand, comb your hair like this with your left hand, and do backstrokes, like swimming. So do 5 sets of 5 of these a day, 5 sets of the itsy bitsy spider 5 times a day. So the backstroke, brushing your hair, itsy bitsy spider, and the last thing is for those of you that grew up in snow, when you were a little girl, you got out in the snow and you did snow angels. You went up and down like this. And if you grew up in the South and there was beaches, you did the same thing and made sand angels. So you're laying on your back, and get on your bed, lay down, put your elbows against the bed, your shoulder blades against the bed, and slowly bring your hands over your head and bring them back down. Now, you certainly don't have to use the bed, you don't use the wall. If you can stand up straight like this and bring that shoulder up, arm up straight like that, that's the stretching that you need to do. You're not really stretching much when you bring your arm up in this direction. Again, the pec muscle will feel way too soft. So those are the recommendations for the exercises that I would recommend you to do in the first week post-surgically. There's sort of some breast massage, which I'll go over with you when you're here. I don't feel comfortable making a video about that. But right now, those exercises will help you get better. Have a great day.